Hello everyone and welcome to this seminar on Ireland's new mental health policy, sharing the vision and mental health policy for everyone. For those who don't know me, my name is Fiona Coyle and I'm the CEO of Mental Health Reform. Mental Health Reform is Ireland's leading mental health coalition. We're a membership organisation comprised of nearly 80 members. Now, our members represent a diversity of interests. We have members who deliver mental health services. We have members who represent particular groups or in society. We have members who work on different topics such as homelessness, such as drugs. And what all our members have in common is that they're all committed to improving and to strengthening Ireland's mental health services. Mental health reform gives them a platform to come together, to share their thoughts, their experiences, to share the experience from those who engage with their services, so that we speak out on various topics with one really strong voice. We also provide a platform for organisations to come together to share their knowledge and experience with each other. So I want to welcome you all here today virtually. I was saying to our esteemed panelists that as Mental Health Reform, when we put our programme together last year, no one could have envisaged, the last 6 months. I think you'd need to go to a very good fortune teller to have told us, what could have happened in 2020. So the original idea behind it was that once the new policy was launched, that we would go out into the different regions, out of Dublin, to engage with those involved in the mental health sector, to raise awareness on the policy, to hear your thoughts and your perspectives. So when we can't leave our counties or leave our kind of home offices, we've decided to do this virtually. So as many of you know, earlier this year, the government launched a new policy, sharing the vision and mental health policy for everyone. Now, the timing of this policy was quite significant. It's one of the few pieces of policy that was launched during the initial lockdown. And we really would like to see that as an indication of the importance there is on mental health in this country. Now, the policy, which we'll go through in a short while, it is very much welcomed by mental health reform and by the sector. It has the ability to be transformational for service users, for families and carers across Ireland. But, a policy, is only as strong as its implementation. You can have many great documents gathering dust on shelves around different government departments, but it's only by keeping the policy a live instrument is how we can really bring about change. And that's the kind of purpose of these seminars, is to make people aware of the policy and to ensure that it remains on the agenda. So we have a really strong panel today, and I'd like to introduce the first speaker. So it's the Minister of State for Mental Health and Older People, Mary Butler. So Mary Butler, as you know, is a native of Waterford and was appointed as Minister in July 2020. She's been a TD for the Waterford constituency since 2016, a member of the Waterford City and County Council from 2014 to 2016. And she's been previously the chair of the Jobs Enterprise Innovation Committee from 2016 till her appointment. And she was also Fianna Fáil junior spokesperson for older people and chair of the Oireachtas cross-party group on dementia. So, she brings a wealth of experience and knowledge into the role. So, Minister Butler, I just invite you to address the seminar and to thank you again for being here with us virtually.
Fiona, thank you very much for your kind words. I would like to thank Mental Health Reform for hosting this event. As I said, I would like to extend special thanks to Fiona Coyle and Kate Mitchell, and also Dania Brown, who is doing the tech support in the background. I'm delighted to be part of this valuable, vital consultation today. As Fiona quite rightly said, it's very important to bring this vision, share the vision to the different regions. And one of the things I did do myself when I was chair of the Oireachtas Commission for Business, Enterprise and Innovation, I actually was the first person ever to bring the commission to sit in the southeast. So it actually sat in Waterford, and the 5 local authorities from the southeast were all in attendance. So I do believe it's important that we do move out into the different regions, and it's great today that I'm being joined from people and groups from Waterford and Wexford. I have made it my duty, I suppose, in the last 3 months to meet as many voluntary and community groups as possible, and I intend to meet with many more, COVID restrictions allowing, in order to understand the on-the-ground experience. Yesterday, for example, I would have visited the Department of Psychiatry in University Hospital Waterford, and then later on in the day I was on local radio, Ocean FM, I think it's called, in Cavan Monaghan, to discuss. They've had quite a lot of incidences of young suicides in the last couple of months. So I was on discussing that. So obviously my role will take me to all parts of the country. Today I'm here to talk about the recently refreshed mental health policy, Sharing the Vision, which is a mental health policy for everyone. Following a comprehensive research process and an extensive national consultation of over 1,000 service users, family members, friends and carers, and other stakeholders, Sharing the Vision was published in June of this year. And as Fiona has quite rightly said, it's the only substantial document that was published during the lockdown. I would like to acknowledge the important role played by Sherry McDade, the former CEO of Mental Health Reform, as a member of the oversight group who developed the report upon which this policy is now based. Sharing the Vision envisages a mental health system that addresses the needs of the population through a focus on the requirements of the individual and promotes equitable access to quality, safe mental health care for all our citizens. And I think this is where this particular policy is different, because it is focused on the requirements of the individual, and that's what we all want to see. It's action orientated, it's outcome focused, and the policy recognises and plans for the increasing need for mental health services and demands for more holistic, person-centred responses. It promises early intervention with a focus on prevention and positive mental health promotion. The policy advocates for timely access to evidence-informed mental health services for server users and their families, carers and supporters, and the provision of additional access routes to treatment. Additionally, it promises a mental health system that works in partnership with service users and their families to deliver a range of integration services and supports. Mental health is not a matter for the health sector alone. Good mental health for the population of Ireland cannot be achieved without a whole of government approach to the delivery of services. Therefore, under Sharing the Vision, tailored measures will be put in place to ensure that individuals with complex mental health difficulties can avail of services across the state without discrimination. So as we're all aware, mental health challenges and issues are not only dependent on the Department of Health, but it's very important. If you have a housing need, if you're homeless, if you're unemployed, if you haven't money to buy your next meal, all these challenges will really affect your mental health. So obviously it's great to see that it's a whole of government approach for the first time. I think recognising that the voluntary and community sector organisations are key partners, the policy seeks to ensure greater support for the voluntary and community sector and promotes increased integration between the HSE mental health services and voluntary and community organisations. And that was so obvious during COVID, where so many of the organisations came to the fore. They moved quickly online to a blended approach to support those. And it's great to say that 90% of all supports for those who were in the system, 90% of those supports were able to be maintained during COVID. And that's in thanks to the voluntary and the community sector who organised, as I said, and moved very, very quickly to a blended online approach. This year has been absolutely exceptional. I don't think any of us will ever forget 2020. At a time when many people are experiencing mental health difficulties in the face of COVID-19, our mental health and well-being is more important than ever. It is my sincere hope that sharing the vision will play an essential role in shaping our responses to these challenges we face now and those that are yet to come. We are now moving into a new phase in terms of how we provide mental health services to the public, heralded by the rapid advancement in the delivery, as I've said, of online mental health services in response to COVID-19. The Department of Health has launched various initiatives to promote mental health and well-being in the COVID-19 context, with expanded provision of online counselling, crisis text line support, and online life skills training being rolled out to healthcare staff and members of the public. To date, 2.2 million has been provided for a mental health promotion and wellbeing campaign through enhanced online supports and to support the HSE psychosocial strategy. These initiatives are early and necessary examples of the sort of holistic whole of population approaches to mental health that Sharing the Vision will be promoting and seeking to advance, once that also includes specialist supports. As our mental health affects and contributes to all overall health and well-being, it is only right that the policy is very closely aligned with Sláinte Care, our 10-year roadmap to transform our health and social care services. Sharing the Vision supports the main goals and objectives of Sláinte Care, seeking to promote better outcomes for service users through enhanced integration of supports and access to services. Throughout the policy's 10-year timeframe, it is of the utmost importance that we continue to maintain momentum. I think that's the key word here, momentum, in order to drive reconfiguration and deliver on the commitments of the policy. Bearing this in mind, I'm pleased to say that the establishment of the National Implementation and Monitoring Committee to oversee the new policy Sharing the Vision is well advanced, and I anticipate that I will be launching it in early October. And I actually had a meeting about that again this morning prior to this, and I'm very, very confident in the second week of October it will be launched. The National Implementation and Monitoring Committee will be key to building upon the fundamentals of a vision for change, driving new service developments, and instigating new approaches to delivering some existing services through, for example, the greater use of digital technologies. Additionally, a number of subcommittees will also be established to look at specific actions contained in the policy and feed into the implementation process. I intend for the NIMC and its subcommittees to be fully representative of the stakeholders, who will be principally involved in ensuring effective delivery of the policy recommendations. This will include strong service user, service provider, and voluntary sector representation. In this vein, I welcome Mental Health Reform's analysis of the policy, and I will certainly take on board any useful and positive insights that might assist the mental health sector in this challenging times. Gaurav Mahagut, and I look forward to listening to the other contributors and to take part in the question and answers session at the end of the consultation. Thank you again, Fiona. Fiona, I think you might be on mute there.
I am. Thank you, Minister. Thank you for those comments and reflections. And you know, I really like your focus on the momentum because I think that's going to be so key. You know, unfortunately, I think Vision for Change, the predecessor to this policy, it didn't quite get to where it needed to. And it's left probably a sector that's frustrated and probably at times angry, and that, you know, that is so willing to help people and to ensure that people are getting the services and supports that they need across the country, that we need to build the momentum behind this new policy and show that change is possible and change will be happening in the years ahead. So I'm going to now do, I suppose, an analysis of the new policy. So I'm going to ask Dana just to share a presentation for me. Yeah, so just to build on what the Minister has laid out, and she's already gone through some of this. So thank you for that, Minister. But just a little bit on the background of the policy. So there was an expert review carried out to inform the scope of the new policy. And out of that review, there were a number of key priority issues, which probably won't come as a surprise to people on this call, around the real priority, the need to prioritize mental health as a wider societal issue, and the importance of the primary prevention and positive mental health, and a requirement to focus on social inclusion and recovery, to expand the mental health services to really meet the conditions and the needs, and to develop really strong governance and financing to include, including research, evaluation, and quality of assurance. In 2017, there was an oversight group set up, tasked with the development of this new policy and coming up with a report. And in that kind of oversight group, there were a number of policy themes that were addressed, including, a wider focus on education and prevention, the wider use of accredited digital healthcare interventions. In addition, the report looked at as well the relevant actions that remained under a vision for change that may be no longer relevant. There was also wider consultations around the country that this group undertook. So that was the process. If we move on to the next slide. And yeah, I suppose Minister Buckler has actually very well laid out the overarching framework and the components that are quite maybe, new-ish to this policy, but that real focus on the individual, that the person is being put at the center, which is something, as a sector we have been calling for a large number of years, that it's not just, mental health is not just the business of the HSE or the Department of Health. Mental health is the business of every single government department. That's something that is very strong in the new policy. Also, the focus on recovery, and any kind of mental health services really need to enhance the inclusion and recovery of the individual, and especially of those who have complex mental health difficulties. Like the vision, the values, respect, compassion, equity, hope, they're all visions that we would really unite behind. There's also principles which are really worth noting that's new, is that recovery obviously is a key principle, but also trauma informed. It's the first time that, in the policy, it's looking at an individual's mental health, not just alone, but looking at it in a trauma informed manner. Human rights, of course, is the key principle, and valuing and learning still remain in there. So how the document is broken up, it's broken into, I suppose, chapters which are called domains, and there's 4 different domains, and each domain has a number of objectives or of outcome areas of focused, aligned to the domain. So what we're going to do in this presentation is bring you through each of those domains, look at, what's the domain about, what are the outcomes, and what do we need to maybe know, and also what do we need to know more about, what's perhaps missing, or what do we need to really drill into a little bit more to ensure that the policy is implemented fully and to the benefit of every individual in Ireland. So to move on to the first domain, if we move to the next slide. So this is promotion, prevention, and early intervention. So as you can imagine, this is all about strengthening individuals' emotional resilience, improving, working towards the strongest possible emotion resilience, strengthening also communities and improving, the social capital through the increased participation of communities. Reducing, it also recognizes, those structural barriers that are, preventing good mental health, and reducing those through initiatives that reduce discrimination and inequalities. And under the new policy, all mental health promotion work will be developed under the framework of a new mental health promotion plan. So if we move on to the next slide, these are the key outcomes. I hope that you can see them. But yeah, they're, you know, around that positive mental health, resilience, psychological well-being as the population, the positive mental health among kind of priority groups through those targeted interventions, the reduction of prevalence of mental health difficulties or reduced severity through early intervention and prevention work, and then of course the whole area of stigma and discrimination through really improving community-wide understanding of mental health difficulties. So lots of really to be welcomed there around strengthening communities, that cross-sectoral approach, which I referred to in my opening remarks as well, enhanced mental health and primary care, really tailored approaches for priority groups, you know, recognizing that there's no such thing as a catch-all, that different groups have different needs and need different types of intervention. A life cycle approach, stigma reduction, older people are very much mentioned in there as well. The expansion of digital supports, which the Minister also referred to, is in there and is in there very, very strongly. And I suppose COVID has catapulted that particular element of the new policy has very much come into focus. So in this area, lots to be welcomed. But maybe just to have a few comments on maybe some of the areas that aren't maybe there, some questions we have, if you want to move on to the next slide. Yeah, great, thank you. Yeah, so I suppose there are some questions that needs to be teased out a little bit more. So Healthy Ireland have a huge role in the whole mental health prevention, in the mental health prevention angle of this new policy. And I suppose we just need to think about, like, Healthy Ireland only recently took on, I suppose, a mental health portfolio, and they're still, you know, new and seeing how they merge that into their existing work. So we do need to reflect on to ensure that, you know, that the kind of the resources, the understanding of the different approaches, including the recovery approach, are really there within the structures of Healthy Ireland, and that, you know, there's real collaboration and partnership across all sectors with Healthy Ireland. Third level students, some of our strongest voices in our membership are our student and youth organisations. And, you know, when we did our consultations, they very loudly said to us, we don't see ourselves in here. You know, third level students in particular are such a huge cohort. Where are we? We feel like we're falling in between the gaps. You know, we're not being prioritised. So, you know, we want to raise that on their behalf. You know, going forward, we need to look at a more blended approach to services. You know, COVID has been a game changer in that regard. And that's something, you know, not everyone has the luxury of being able to engage digitally. And that's something we really need to keep at the forefront of our minds when we are talking about e-mental health, that sometimes those who may need support the most may not be able to access. I know even from talking to service users in the course of my work, I hadn't even understood, you know, if you're using a pay-as-you-go phone, how much data a Zoom call can take up. You know, and these are things we just really need to engage with people and understand their needs. Also kind of some broader comments around non-specialist perinatal mental health supports, you know, are not kind of noted there. And also in terms of kind of a gender sensitive approach, while it's a much stronger document and while it recognises some of the gender elements of mental health services, that hasn't been mainstreamed maybe throughout the document as strongly as it may or should have been. Yeah, so that's the first domain. Moving on to the second one now, which is service access, coordination and continuity. So this domain, what's it about? it's all about kind of accessibility, ensuring our services are accessible, that they're driven and put together based on evidence, recovery orientated, trauma informed, really based on input and feedback from people with lived experiences. Of course, then they need to be clinically effective and delivered really in adherence to the statutory requirements, which is a given, I suppose, and based on an integrated multidisciplinary approach. So quite a lot covered there. The outcomes in regards to here as well, that it's very much again to the individual, to the service user, has timely evidence-informed interventions, that it is kind of organized to ensure increased numbers of people to achieve personal recovery. So really to ensure that as many people as possible are able to live their best mental health. That health outcomes for people with dual diagnosis are improved. So this is really welcome by mental health reform, and I'll speak to it a little bit more in a minute in relation to, the lives aren't straightforward, as many of you know on this call. Like, having a mental health difficulty doesn't mean, you might have an addiction issue or you may have a disability. We need our services to be fit for purpose for individuals and the experience of individuals, whom many of them do experience more than one difficulty, and our services need to respond to that. And finally, that our services are coordinated through a stepped care approach to provide continuity of care that will deliver the best possible outcome for each service user. So moving on, like the core aspects of this to be aware of is, I suppose the composition of the community mental health teams is something that is noted and has been discussed, that in terms of the lead, the policy does outline that a community mental health team, that no longer the lead may have to be the psychiatrist. So that is a notable change that has been discussed in other forums. Dual diagnosis, I've already mentioned that it was absent from a vision for change. It has got some really interesting ideas around out of hours crisis cafes and tele-psychiatry models. So really, we know that there's huge need for that 24-hour access, and to work towards supporting people so they don't need to present to A&E. So that is welcomed. There's enhanced role for the voluntary and community sector and community and primary care. There is also much more discussion on social prescribing. So for those of you who don't know social prescribing, it's a term used for when, if you're feeling you need support, the first point of call for many people in Ireland is to go to their GP. So instead of, a GP may be prescribing a prescription or prescribing into kind of primary care, and a person being put in a waiting list for a talk therapy, then the social prescribing would be, the person there may be supports available in the community, such as the supports that many people on this call are delivering, that the person should be linked into. So that is welcome, but again, it'll need kind of the buy-in from not just those involved in mental health, but also kind of GPs and the wider medical community. So the step care approach and integration of services, very welcome, as well as additional day hospitals, home-based teams, assertive outreach teams, and crisis resolution teams. There's also some interesting language on it, on kind of the physical settings, and shared governance model and team coordinators. So, there's a lot of information in there, and I'm not doing it justice in terms of the time frame that I have, but this is just to give you, I suppose, some of a taster of what's in there, and may ignite, some more discussions. Then there's other stuff around CAMHS, which has been noted and discussed around changing the cohort from CAMHS from 0 to 18 until 0 to 25, reconfiguration of older people services, individual packages, review acute inpatient capacity and patient flows, mental health and intellectual disability model of care, investment in clinical care programs, and access to mental health services for those in direct provision and those who are seeking asylum. And, you know, really importantly as well and welcome is the early diversion schemes from the criminal justice system. So to ensure we do know that a really high percentages of those who do go through the criminal justice system do need mental health support. So instead of, you know, bringing them to a point where they need to go into kind of the National Forensic Hospital, to really make sure that the supports are available to them along their kind of their various points in the justice system. And again, you know, this is something that perhaps, you know, we need the buy-in of the Department of Justice on. It's not just a health issue, it's a Department of Justice issue. So to move on. Yeah, so I suppose just some of the kind of the comments and the reflections that we have and that have come up in the mental health reform consultations with our members was around the kind of the composition of the composition of the community mental health teams, the role of the community mental health teams as well in relation to those out of our support. You know, when we are talking about putting things in place like crisis cafes, we need to ensure that, you know, the support that's there, it's the right support that's available. And we would see the community mental health teams as being really key components to that. While, you know, it does look at the individual, there isn't, you know, what's come back in our consultation that there is quite a lot, kind of not enough focus maybe on particular groups who do need that additional support, such as those in prison, the homeless population, ethnic minority groups, the LGBTI plus communities. It's also been highlighted, you know, their need for specialist mental health services for deaf people, and talking therapies in specialist services, and alternative supports for young people and children, you know, beyond kind of, I suppose, the more medicalized model that's there, that there's a real need to kind of have a variety of supports available. Yeah, then the social inclusion. So this is the third domain, and this is about, you know, enhancing the social inclusion of those who are living with severe and enduring mental health difficulties, really to ensure that everyone can get their best possible, you know, mental health, no matter, you know, where you are in your mental health journey. So looking at areas such as housing, employment, income, education, just really so that service users and their friends and families and carers feel really connected and valued in their communities. Again, there's a rights aspect here, and that's been really pulled out in the policy around the UN Convention of the Rights of People with Disabilities. That we really move forward with our commitments underneath that international treaty. Then the promotion of recovery among individuals. Yes, so I suppose many people on this call for many years would be really promoting a recovery model, and that we really need to ensure that that at the core is in the individual, and the individuals kind of to support them to recover and to really focus on their recovery. Yeah, so I suppose just to move to the outcomes, and I'm aware that I'm a fast speaker at the best of times with a slight Donegal twang, and the time pressure, I'm rushing through things. So please do comment in the chat if I'm going too fast. I will try and slow down. But it's a really kind of the breadth of the policy. There's a lot in it. So I'm just trying to make you aware of the different elements and give you a taster of where we're going as a sector. So under this, you know, service users really that respect, that value in their community, improved outcomes. So it's not just about the health outcomes. You know, for someone to live a healthy life, you know, they need decent work, they need decent housing, they need to be able to access education and to be able to grow, you know, things that many of us take for granted, but, you know, that need to be really looked at by different government departments in light of this policy. And the increased ability to service users, you know, to really manage their own lives via stronger relationships and sense of purpose. So really strong words again, much to be welcomed in it. So maybe to look into more of the kind of the details, as Minister Butler said, it's very much an interdepartmental agency approach, equal access to housing. There's a joint protocol there between, you know, the Department of Health and the Department of Housing and local government, housing planning and local government. A lot kind of around housing, which I won't go into the details on due to time. But, you know, the other things that are interesting is in terms of like reference to a flexible benefit system. So, you know, this is something we've been advocating for in a long time, that, you know, sometimes due to the episodic nature of mental health difficulties, you know, people may go in and out of employment, and we need a system that supports people, so, you know, that they're not falling between cracks, and, you know, they're not it's not feeding into their kind of their difficulties or benefit system. And then the peer-led support, which I know our other speakers are going to talk more on, and then the to move on to the next slide. Yeah, so I suppose there's things, you know, the housing needs is something that does need a lot more work. You know, there has been work on this, but, you know, we need broader housing reforms, specific details, like, you know, it's very aspirational in terms of the flexible income system, but this is something we found in our experiences mental health reform, that we need the details to make that change happen. The, you know, youth peer led supports as well, you know, that we're not just focusing on the kind of the adults, but that there's also, you know, young people who, you know, I've come across many of them who are amazing advocates and are supporting their peers, that they should be specifically mentioned in that as well. Yeah, so then the last domain, but maybe we should kind of say maybe saving the best to last, because, you know, without accountability and implementation, the previous three domains, you know, I don't think, you know, they would be void. So I suppose a lot of what was identified as perhaps a weakness of the previous policy, it has been, you know, identified and rectified within this domain, which is really, you know, about looking at kind of mental health in policies, that there's like strong governance, that there's, the minister always also spoke about this oversight and implementation group that is there. It also speaks, you know, to improving, you know, the physical infrastructure, that innovation needs to be there. It needs to be kind of, I suppose it doesn't specifically mention funding, but, you know, it that comes with it. And then around research, especially on kind of self-harm and suicide, and really focusing on what do we need to do to make this policy a reality? What do we need to do to really, you know, in 10 years' time, to have said, you know, we really changed people's lives with that policy? So just to move on maybe to the outcomes. So yeah, I won't go through them in much detail, but it's a cross-cutting priority, performance monitoring, improvement, and then like high-performing services that, you know, that meet all the kind of the needs, the regulatory needs, and have the confidence of the service users. So yeah, I've gone through some of these already. So it's like those performance indicators, which there is going to be a process to develop. There is going to be a national mental health information system, which, you know, I think could be really transformative. Regular surveys of service users and family friends and carers, you know, make it more part of the process. And the reform of the mental health law that I'm very confident, I hope Minister Butler will, you know, may have ticked that one off by the end of the year, is our hope by mental health reform to build that momentum right from the beginning. But yeah, so a renewed focus on complaints, outcome-based resource allocation, greater focus on innovation. And I suppose then maybe in terms of some of the kind of the questions in that regard, you know, we've been calling on this for since the position became, you know, was no longer there, but we need, you know, you need leadership. You know, without leadership, this policy is going nowhere, and we need someone there in the HSE at a senior level with the strategic portfolio, linking into Paul Reid or whoever the CEO is to drive this. You know, with the new regional structures in the HSE, how do we ensure mental health is prioritised? Funding, you know, it's without funding, you know, and significant funding, this is not going to happen. And, you know, the engagement structures for the service users and their family, friends and carers as well. So just to conclude on the kind of implementation, the Minister already spoke about this. So there's the implementation and monitoring committee, there's short, long-term recommendations. But our question always is, you know, where's the Oireachtas Committee on Mental Health? You know, we really do need, if this is something we're serious about, we need that Oireachtas Committee there to drive it forward and to have that prioritisation. Yeah, so just kind of finally, really positive components, you know, really transformational. Like it's different to Vision for Change, where it's a much more of a blueprint of where we need to go. It's more kind of it's more conceptual. And I think people had questions on that when we did our consultation, because they were looking for much more detail. But conceptually, there's lots of evidence, there's lots of kind of great things there. There's lots of opportunities to shape, as the Minister said. But yeah, I'm really happy to have the Minister with us, because, you know, the political will is so important, and the leadership, and to hear her words that she gave us, you know, coming up for funding and to budget 2021 and into next year. You know, we're fighting, we're trying to raise as much awareness as possible on the need for funding. So, you know, it's going to be really important. And, you know, we just need to implement, we need to build that momentum and to start to create change, to change people's lives so that they can see, you know, that there is priority, that they have been given priority and the services are going to be there. So apologies, it's been a bit of a rush of a presentation. We could probably spend hours discussing each of the domains because they are very rich. But yeah, I hope that gives you a taster, and we were more than willing to share with you the presentation and our kind of full policy analysis as well. So just to kind of keep on time and to ensure that we're kind of giving as much time to discussion as possible, I'm just going to go on to our next speaker. So Gina, I want to invite you. Gina Delaney, many of you will know as well, works with Mental Health Ireland as a development officer for the South East, and also with responsibility for family recovery nationally. And Gina brings both professional and lived experience of family recovery. And I know, Gina, you're very passionate about supporting well-being and recovery for everyone, not just the individual, because, you know, that's at the heart of this new policy. It's not just the individual that's impacted by inadequate services, it's the family, it's the communities, it's the schools, you know, it's much broader. So Gina, the floor is yours to share your thoughts, and thanks for being here with us.
Thanks a million. I'm delighted to be here. Can you hear me okay now?
Yes.
Hopefully, that's great. Okay, thank you. So I'm delighted to be here, and delighted to be here with Mental Health Reform and with our Minister, and also with Sharon, our peer educator, who is going to be along there shortly. And I suppose just on what you were saying there, Fiona, I often draw on the analogy of when we had really bad storms there, probably last year, I think it was, and Met Éireann really kind of hit the nail on the head. The speaker from Met Éireann said, power outages all over Ireland are affecting families all over Ireland, and I thought, well, how is it that the weather can affect families, but when it comes to mental health, it just feels like it's just the individual that's affected and just the individual that's supported. And I know that this is changing now, and it's so welcomed, and the policy I think is just going to really support that move. So my role is my role as development officer with Mental Health Ireland, and very much part of what we do, and all of what we do really, I suppose, is around working with our community partners and working with our mental health services to support the mental health promotion, well-being and recovery. And for myself, I suppose that would be across the southeast here, including Waterford and Wexford. And I feel very lucky that I can bring my work experience, my professional experience, and also then my lived experience of growing up in a family where there were mental health challenges, and that brought its own challenges for me in that. But I suppose that's not what I'm going to focus on today. It's really around, I suppose, the voluntary community input into this policy. But I just wanted to say that because I suppose bringing those experiences to my work and in my partnership working, it just really I suppose brings my awareness of the importance of the integration with the community service, with our partners and with the mental health services, the value of co-production and the value of having lived experience at the table alongside the professional experience, and having the strengths of the values and the principles that are within sharing the vision. And I was so happy that they are emphasized within it, and that you had spoken about them as well, Fiona, within that, because I suppose without an emphasis on the how we work, it leaves the work empty, because we can do our work, but unless we do it in a way that is, respectful and has those values of hope, respect, compassion, equity, I think we lose what we're trying to achieve, unless we're doing it in a way that is like, follows those values. So also then I suppose that the emphasis on the principles is really, really important. And we have the framework for recovery, focusing on the recovery, and the importance of having a recovery focus embedded in how we work, but also in what we do. And the same, I hope that the same will apply for having a trauma informed and a trauma responsive service. It's really important that we do that, and that we look at the human rights, and that a whole area of value and learning as well, that that we value and we respect each other, that everything that all of us have to bring, whether it's family, lived experience, or service provider community and mental health service, we all have something unique and valuable to bring to the table in all our interactions. And that working off those values and principles is really, really important and shouldn't be lost within it. And I think that what's good about that is, I suppose, and looking at the determinants of our health then as well, and what impacts on our health, it's just bringing in that whole human experience. And we're all made up of our experiences. And I suppose, as I said, I come from a family where there was mental health challenges, and I also live in a family where there's life challenges, and each and every one of us can say that we're all impacted by life every day of the week. Some days better than others, and I suppose these are the types of conversations that we need to be having with each other, with our friends, with our families, with our community supports, and with our mental health services. They're the conversations that will help us move forward as we recover from whatever it is that has impacted on us, or particular trauma, or different experiences that we might have had that have impacted on our mental health. when we focus on those types of conversations, you know, it just really helps, I suppose, to reduce the stigma. So that's, I suppose, around the determinants of the mental health, just taking in that whole wider experience of the human experience and the holistic approach to looking at, you know, kind of our who we are and how we live and what impacts on us day to day and week to week. So I suppose that's really the good part as well about having our new the mental health promotion policy. So we're welcome, Sharon. Sharon's talking now in a minute. So and the emphasis on the recovery. So and within it then as well, I suppose, talks about the stepped care approach. And that's really what it is, like, you know, that I suppose that you get the least, I suppose, the highest level of support that you need at any point in time. And starting off with your immediate circle of friends and your networks, and moving then on to other supports as they're needed. So then looking at the domains, suppose we have the 4 domains, we have the 15 outcomes, and we have the 100 recommendations, and that's where that real the importance of the joined up process and that interconnectivity, you know, with each other, with our community partners, and with the mental health services for the implementation and the monitoring process of it. So and really, I suppose, to use those existing policies and strategies and frameworks that are in place. And, you know, I suppose to be respectful and to value the work that is being done, that people are feeding into, you know, already, you know, with the Framework for Recovery, with the Healthy Ireland's Launch Care, Connecting for Life, and the new mental health promotion plan, you know, to be working effectively and smartly by bringing all of that together, you know, and to connect all of those together. And I suppose there's already a huge amount of work and connectivity happening with the community and voluntary sector, with the mental health services, with each other on those groups. And I suppose really to make sure that, you know, that all throughout the process, that we have the values and the principles and co-production all throughout that process, and that there's a real focus on the how of what we're doing. And just to bring it to life then with a few examples, and Sharon will do that also, but you know that we have those existing groups already across the southeast and in many areas around Ireland also, but you know the link up groups, those community connection groups, the recovery forums, recovery committees that are focusing on advancing the framework for recovery and the actions within that are really promoting the values and the principles that we're talking about within Sharing the Vision. The area forums through the mental health engagement and recovery, those area forums that are already in existence, that will bring together our community partners, people with lived experience in mental health services and families. So also then the crisis cafe or the community cafe, I suppose, might be a nicer term, I suppose, you know, that I suppose they are an involvement centres, those peer-led spaces that are connected with our mental health services and with our community services. So bringing us all together so that I suppose that people are getting the right service that they need, you know, rather than having to go straight to maybe A&E or, you know, maybe straight to the mental health services, that there are peer-led areas in our community. And that's being worked on at the minute, particularly in Kilkenny, a space for a community crisis cafe, and we have involvement centres in other parts then as well in the southeast. The individual placement support around the employment support, particularly well in Wexford and Waterford. You know, employment is a big area in people's lives. If it's not going well or if it's not happening at all for us, and to have people that can actually just support us through that process of finding out what it is that we want to do and how can we actually go about that. The social prescribing and the recovery colleges, another couple of examples there in the southeast where these are working well and can really be supported and enhanced by this policy. And the social prescribers are actively reaching out now and connecting with their local mental health forums, with the recovery colleges. And the recovery college is making such a difference and such an impact, and Sharon will be able to talk about that as one of their facilitators. And then I suppose just to wrap up, like, you know, that the policy it's an outcomes based policy, and that's really exciting, you know, that we're focusing at the beginning, you know, of what is the difference that this is going to make, why are things going to be better for the individual because of this, and how do we know that? And I suppose that's by asking, isn't it? Asking the people who are, you know, going to be affected, who are using the services, who should be able to feel that difference, family members, service providers in the community and within the mental health services. Asking, I suppose, people, you know, is it different and what's different, and is it working and how is it working, and using the existing mechanisms that are in place to do that as well, you know, rather than reinventing the wheel. So, you know, we have the framework for recovery, those monitoring and implementation groups in existence, the forums, the mental health forums, through the area leads, there's local and area forums established, and there's people are already meeting there, you know, they can tell you what's working, what's not working, and what's the difference that's being made then by this policy. And the area network groups that I said as well, all those area network groups that are, say, we have them in the southeast and in other areas then as well. And I suppose the importance then of ensuring that there's, you know, regular reviews and that we're measuring the impact and the change that's being that's happening as a result of it and getting that feedback. So yeah, well, Mental Health Ireland just, you know, really welcomed it, and I suppose it matches with what we do and how we do it, and looking forward to the future of it. So thank you.
Thanks so much, Gina. And yeah, I loved your powerful words at the beginning. You know, that really struck me. You know, we need to talk more about the mental health impacts on communities. You know, there are communities who have been adversely affected, the length and breadth of the country, from Waterford to Donegal. And yeah, it's really important that we're, with this policy, it's real. Whether we've known it's worked or not, is if we go into communities and ask them in 10 years' time, what's changed? You know, are you being better supported? So thank you for that. So our final speaker is Sharon Maher. So Sharon is from Waterford. Many of you will know her as well. So it's a lot of Waterford people on the line today. She's a recovery educator with the Recovery College in the southeast, and she's a person with lived experience of caring and supporting for family members. So Sharon, thank you so much she's actually come out of delivering a training to come and speak to us. So we really very much appreciate you being here. So the floor is yours to share your thoughts on this new policy. What do you think?
Thank you very much again. And I suppose what I took from the new policy, especially being a family member, I think one of the most important phrases I saw in the policy is that a person with a dual diagnosis would have access to the mental health services. I mean, that's huge for me. I mean, that will make a difference in so many people's lives, that they even know that's, you know, that they can access mental health, you know, that they're not kind of held back because of an addiction challenge, say, you know. And also, one of the other things I took from it as well is that they want to develop kind of out of hours services. And I think they're so important, especially at weekends, especially with young people. You know, weekends are kind of a crisis time for people. You know, they kind of tend to misuse substances, you know, at the weekends. And I think, you know, more development around that would be very, you know, it'd be really, really good if that could be developed further, you know, kind of even if we could even see in our community how that might be implemented, kind of what could we actually do. But to have that in the policy, that's a recommendation, is just, it's very, you know, it's really reassuring to have that as well. But I think my top one now would be, you know, being a recovery educator is just the development of recovery education. I mean, you know, as a family member with lived experience, you know, mental health would have never been spoken about years ago, you know, just brushed under the carpet. But now I've actually come out today, I'm actually sitting out here, come out of a training where we're training recovery principles and practice to staff. And I mean, that's such a really huge step forward progression, you know, in the mental health services. That would have been unheard of again in years ago. It just wouldn't have happened. I mean, that's amazing. So that, and I mean, my role then, I'm recently appointed. I'm a recovery educator, and I mean, I'm with Recovery College Southeast, and what we do, we co-produce workshops, and every one of us has lived experience in the, you know, working together in the Recovery College. We all have lived experience of either a mental health challenge, or somebody might have addiction challenges, or both, or else being a family member or a carer or a supporter. So I mean, I think we're really doing really good work in that way, that we're trying to give people the access to the education as much as we can. We're giving Zoom workshops at the moment because of the current situation. But I mean, you know, we're trying our best to kind of give everyone as much access as they can to the programs. I mean, that they're very, very interactive as well. And I mean, we're always learning all the time ourselves. We all kind of, I think through the recovery education, especially, that was, you know, that policy that was implemented in the Vision for Change, even that we're doing this now, that it kind of brings us all together, that we all kind of understand each other, you know, and you know, that's so important in, you know, breaking down stigmas, and you know, in mental health. It's just, it's, and I hope it'll go on as you know, with the new policy as well, that more recovery education kind of focus pieces will be developed, you know, and that the word will spread, that it's, you know, that people can access these things. So that's my take on the policy. I think, you know, it's a great step forward. I think if it's all implemented, it's very positive. I think it really gives you hope for the future. Yeah.
Sharon, that's brilliant. Thank you for those words. And yeah, like one of the things that I was struck by recently as well is someone told me, by having dual diagnosis back, you know, recognition that I'm not a problem, because that's how people felt, that you were going to one service and you were presented maybe with a number of different difficulties, and you were seen, you know, maybe not deliberately, but the sense you get when you feel the services you're being pushed to door is that you feel like a problem. And you know, I think that if we can change that for people, it'll be really, really powerful. So I'm going to invite all the speakers to come back on with their cameras. And I'm aware as well, the Minister, of course, is exceptionally busy. And so I don't know how much longer she can stay with us. But there is a few questions that have come in through the various chats and then beforehand as well. So Minister, there was just a few comments that came through. One person asked in terms of when will the policy become active? So I suppose that's a big question. And then someone else sent in around how can we ensure that you know, we get buy-in from the other government departments, both at the national and then at the local level as well, because I think at the local level, you know, the difficulty of achieving that is probably greater as well. But yeah, any reflections you would have that on those questions, Minister, would be great.
I was deliberately staying on mute because the bell is ringing behind me, and I hope it's not going to disturb you too much, but I'll do my best. Firstly, can I just say, to hear from Gina and Sharon was absolutely fantastic. Gina, I was really struck by, you know, your lived experience combined with your professional experience, and you know, the fact you said some days are better than others. I think we all feel like that, and it's most important, I think, for people to get into the mindset that tomorrow will always come, and you know, it mightn't have been good today, but it can definitely be better tomorrow. And you know, it's great to hear about the community, the cafes, the crisis cafes. Last week I was involved in launching the 21 dementia cafes under the one umbrella. And I'm just wondering, is it kind of a similar, is a similar team that, you know, that's someplace where people can go, they can drop in, they can have the cup, they can have the chat, and they can feel they're not alone. In relation to Sharon, you know what, you're a breath of fresh air, recovery education, I just think it's the way forward. And for you to be able to say that you have lived experience, and for many years it was brushed under the carpet, and to be able to come out front and centre now today and to be able to deliver this on a Zoom call it's inspirational. And that's what we need to hear for the new chair and division, for the new implementation and monitoring committee. We need to hear lived experience. I'm just such a firm believer in listening to people. You're on the ground, you know where the challenges are, you know where the pitfalls are, you know where the blockages are. I can listen to officials all day long, but that's why I'm trying to get out and visit so many places, as many as I can because of COVID. There are some restrictions there. In relation to Fiona, your question, so when will this plan be implemented? Well, this morning I actually had a budget talks in relation to funding for the plan. The way I look at it, the plan has already been implemented on the short term. You know, we'll have to deal with the mid-term and the long-term aspirations, but it's already been delivered in relation to short term. And, you know, I do take on board, Sharon, the point you made about dual diagnosis. So many people have brought that up with me. And to be honest, I suppose, it's not something I would have been overly familiar with before I came into this role, but it's hugely important. And nearly before, it was nearly an excuse. Look, unless you have one part of your diagnosis sorted, you know, you might have alcohol addictions or you might have drug addictions. We can't deal with your mental health addictions. You have to sort that first. So seeing that recognised front and centre, I think, is hugely positive. So what I would say to anyone listening, it is a 10-year plan, and people say to me, we can't wait 10 years. We absolutely can't, which has already started as far as I'm concerned. And I think the blended E approach is already up and running. And we have made so much ground in 6 months because of COVID. We have so much, I suppose, interaction now with the NGOs that probably would have taken a lot longer to happen if it wasn't for COVID. I think the department and the HSE had to embrace all the NGOs and look for their supports, which is hugely positive. In relation to whether the other cross-party supports will come, interestingly, I met with Sean Moynihan from Alone last week, and they have come up with a great plan in relation to housing for older people, and obviously that all encompasses mental health as well. And I know he was working with my department officials and also working with Darragh O'Brien, the Minister for Housing officials. And I just see a tweet there today from Minister Burke had met with a group in Clare in relation to housing first. So certainly there is a lot of positive actions. And, you know, I suppose what comes with a new government, and it is an unusual government from the point of view, it's a three-way coalition, but I think everybody is new into their roles, everybody is vibrant, everybody is positive, everybody is trying to make a difference. And just to show you a little thing I've been working on myself, because, you know, when you were talking there earlier, you were talking about third level students, we were talking about secondary schools, about the various challenges. So I'm currently working on this leaflet that's going to go into, I have 500,000 of them going into all secondary schools in Ireland in the next few weeks for Mental Health Week. And basically what it does is it signposts all the different groupings and organisations that can support. I met with a group of students from UCC about 3 or 4 weeks ago, and one of their friends had taken his own life. And they told me that they had never heard of Jigsaw, for example, before he had died. Now, they were aware of Chalk Tom because they were from the Kilkenny area, and they were aware of Chalk Tom. But what I learned is, like, I said to them, how many of you would know that if you text 50808, you'll get an instant reply? They didn't know what I was talking about. So it put me thinking, and I was just thinking, if I could get this leaflet into every transition student in secondary school, and now there's a lot of them, so I'm talking about 500,000 of these, and we're also going to roll it out very, very strongly online. And if any of you would support it, that would be absolutely fantastic. But, you know, I met with all these groups, My Mind, Spun Out, Belong, as I said, Jigsaw, Childline, every group I possibly can, and that are endorsed by the HSE. Obviously, there's a huge amount of groups do a lot of work, but they wouldn't wouldn't have the same endorsement. So I had to stick to the ones, you know, but just to try and get this, you know, even if they only put it into their school bag and they might be at home in the night and not feeling the best, and they might pick it out and they might look at it and say, I text that. And I just felt if we could reach out to kids in secondary school, it might be, you know, a step in the right direction for them. Another thing I just wanted to tell you about, which was launched in Waterford last Friday, and this was by the Chamber of Commerce, the Council and the Older People's Council. It was a happy to chat bench. So like a buddy bench in a school for a child. So what has happened is the local authority has put signs up on some of their benches on the quays in Waterford. So if you sit there, there's a sign up saying you're happy to chat. And it means that you might be having a bad day, you might be feeling lonely, and would somebody sit down beside you and have that chat? And you know what, it was, you know, the benches are already there, so it only took to put the signage on the bench. And we launched it last Friday, and the Gardaí were involved, as I said, the local authority, the Chamber of Commerce. I was there myself as Minister for Older People, and it's getting great traction online and getting great traction in the local media, you know, so there is a lot of good things happening. Fiona, did I miss any of your questions?
No, we've provided us with even more information, and I think you had a question back to Gina. So around some of the crisis cafes stuff.
The crisis cafes, yeah, I'd love to hear about those, Gina.
Yeah, the crisis cafes. So they're being, I suppose, they're being piloted now soon, one in Kilkenny and one in Galway, and they've been based on, I suppose there was a visit over to Aldershot in the UK, and they have one up and running very well there and very successfully there. So I suppose, you know, it's important obviously to base it on something that's, you know, evidence-based and that as well in what we're doing. Yeah, they're working very well. What we're doing is it's very much in partnership, you know, so it's a committee so far, a working group made up of lived experience, made up of our community representatives and made up of the mental health services. And we've done a feasibility study just to, I suppose, to look at, say, where would be the best place to have it and what would be the best way to do it. And that's where we're at. So we're on the cusp of piloting it in Kilkenny now. And I suppose we're hopeful of great success with it, because I suppose we're listening to, you know, people are saying we don't want to go to A&E. That's not where we need to be. We need somebody who can listen in a nice, warm, you know, welcoming environment. That's what people need. And I suppose we'll be very excited now to work in Kilkenny on piloting that. Yeah,
no, it's fantastic to hear that. And I think, you know, a lot of what I was hearing today about the crisis cafes and keeping people out of hospital and helping the community, you know, it's nearly like what we launched last week in the HSE winter plan about older people and keeping them out of acute hospitals. It's the whole premise, I suppose, of Sláinte care in the community, care when you need it, the correct wraparound supports. But I suppose it's to get the momentum going that those supports are there, because I speak to a lot of people who would have come out of the acute system, for example, and who would have had to stay in hospital. And I was delighted to hear when I was in the DOP yesterday, the medium stay, for example, at the moment is 12 days, which surprised me. I thought it would be longer. But I think sometimes what happens is, and it's a postcode lottery, which really, really concerns me, that sometimes the supports are not where you're living. And then what you have is people, you know, they regress and they end up being admitted again into the acute ward. And this is what we have to try and stop. We have to try and keep our people out of, you know, the acute settings. And it was interesting when I spoke about one of the executive psychiatrists yesterday. You know, we spoke a lot about young teens and adolescents being admitted to hospital, and he, you know, under 18, and he would have said to me that his whole thinking has changed on that completely. He would have thought initially that that's the way forward, but now he believes it isn't. And I just think, you know, we have to be able to accept change, and we have to be able to change our thinking, that something that might have worked for 10 years might not work anymore. And you know what was said earlier in relation to sharing the vision, very good document, but unfortunately, I suppose, you know, maybe it was a bit ahead of itself. Maybe it was at the wrong time. You know, the economy was gone. Whereas now, I think even with COVID, we're in a much better place to deliver this policy, because firstly, I'm going to make sure it is delivered. But secondly, the point I want to make is mental health was never more pronounced at the moment. Like, you know, there's nearly a situation where, and I'm trying to phrase this in the correct way, every single email comes into my office, whether it's somebody waiting for a hip replacement or a cataract or it's housing. Mental health seems to be tagged onto every single email to say, you know, and I don't want to take from all those people who are in the acute services or those people who are in primary care or people who have lived experience, and I don't want to take from them. And I nearly think at this stage, like when I was listening to, you know, we had a lot of lobbying from the publicans trying to open, and it was affecting everyone's mental health. I don't want to reduce mental health. Mental health is very, very serious. And if you have ill mental health, it needs to be considered so. But at the same time, I don't know whether Fiona, you're getting the same thing, but every single interview I hear at the moment, mental health is thrown into the mix. And I just want to try and take it as serious as possible, you know. And as I said, I'll be working very hard. I know we'll be talking on Thursday in relation to budget and that, but I will be working very hard because, you know, there's a very canny TD here. He's in the Dáil a long, long time, and he said to me there recently, look, Mary, he said, I know you have the best of intentions, but if you don't get an increase in your budget, he said, you know, things will only stand still. And I have to say, those words have stuck with me the whole way through. So I'm working hard at the moment on budget.
Thank you, Minister. Yeah, we're with you in that fight. And yeah, no, we've been hearing, it'd be interesting to hear Gina's perspective as well. Like there's been a lot of discussions on mental health, but it's everywhere. But there's also a sense from speaking to some service users, especially those who would maybe have the more, you know, the severe kind of difficulties. They feel that the conversations are at a level where they're being even more stigmatized as people who may need to go in and out of hospitals. And, you know, when you know, you were rightly talking, like in the winter plan, like the feedback we've had is that people who have been going in and out of hospitals feel like once again that they're not recognized as a priority, that the priority has been people with physical health difficulties in that plan. And I suppose we've traveled a long journey, but it's getting that understanding. And I'm really happy to hear it from you in particular as the Minister around the real breadth of the mental health kind of, I suppose, the agenda. People, you know, who may have difficulties in may need to access community services, and then those who need more specialized primary, secondary, etc. So yeah, it's something we're very aware of, that there's an opportunity, but it's also a time that people are feeling a bit stigmatized. So to put that point across, I don't know, Gina, if you've been hearing likewise from the people you engage with.
Yeah, well, we did a piece of work, a partnership with Sea Change there recently. So, and we just brought out our booklet. It's a guide to returning to the workplace in the middle of this lovely environment that we're in. So, and I suppose we did a lot of, like, you know, everything we do is co-production, like, you know, so we did a lot of speaking with people who are returning to the workplace, whether they were coming from a service provider perspective or from lived experience perspective, you know, just I suppose that they were returning to the workplace and what were the issues that they were facing. And what came up was kind of either one of two things: either that people were had never experienced kind of what would you say, challenges around their mental health before, and now they were, and like say through the, like say maybe feeling overly anxious about, you know, going in and having extra touch points, whereas they had been at home in their own home and feeling much more safe and secure, or you know, the concerns about bringing home virus to their family, or just bringing home stress to their family, you know. So like these were kind of the anxieties that they were facing. And then on the other side of them, we had people who were saying, well, I already have an underlying kind of issue around my mental health, and now I feel like that it's kind of, it's bringing it on even more. So maybe in examples where people have say maybe social anxiety, and you know, we've been at home now and we didn't need to really converse so much, or if it's in a Zoom meeting, it's very much, I mean, people log in on the time and they exit then on time, isn't it? You know, so you don't have those maybe kind of moments where you have to kind of chit chat or that, like, so we've kind of fallen out of sync of being able to do those things. So it's kind of exasperating anxieties or stresses or conditions in people where they were already, and then potentially bringing them on in other people, you know. So yeah, that's kind of the feedback that we got.
Gina, thank you for that. Fiona, I'm going to have to leave, I'm afraid. I have another meeting at 1:30. I've back-to-back meetings all day today. Listen, it was great. It was great to hear from Gina and Sharon especially. It's great to hear something, you know, lived experience, as you said, and the fact that you're on the ground. And look, happy to engage at any stage. Gina, I'm sure I'll be seeing you. I'm you know, and look, what I haven't time to discuss, but I met the group from Waterford in relation to social prescribing. I think it's a fantastic idea. You know, I'm learning so much myself. I have to say, I'm trying to take it all in. And it's, you know, it's absolutely, I think there's a huge amount of good work being done, and we have to, the key word for me at the moment is momentum. We have to keep it going. So listen, if it's okay, I'll leave you now, and if you want to put up a pic or anything, I'm more than happy. You know, if you want to do anything on social media, there's no problem at all. Thanks a lot and all the best.
Thank you, Minister.
Thank you for your time. We really appreciate it.
Bye now.
Thank you. Bye.
Yes, so apologies to Nicole and to John who've sent in questions. What we can do is we can try and follow up with the Minister's office, in particular around the distribution of the leaflet that she told us. I think, John, that's a great idea. In terms of, it's a great idea just in terms of the third level students. So we'll try and do that. And yeah, like Nicole, around the policy being implemented, what would the changes in the grounds be? When will they come into fruition? I suppose a lot of it is dependent, I suppose, on budget allocations as well, and what can be done in the coming year. So just before maybe we finish, you know, the Minister spoke, you know, she's fighting for mental health budgets. We know it's a very difficult year, but unless we get that investment, you know, none of these changes, which we welcome, will be able to be implemented. So for those who aren't aware, mental health reform, we do have a budget campaign ongoing at the moment, and we'll put a link into the chat box. As part of that campaign, we've partnered up with Uplift, who are providing a service for us. If you click into the link, it'll automatically kind of email your TDs and your elected representatives. You know, we really need to make as much noise as possible. I was saying to someone last week, you know, the vintners managed to create an almighty noise, but you know, mental health, this affects, you know, so many people, individuals, families and communities around the country. You know, we deserve to be in that spotlight because, you know, there's no other option. We need to fund services, and we need to support people, especially, you know, in this kind of pandemic where we know that the needs are so much greater. So yeah, I just want to finish just by really thanking the Minister for joining us virtually today on this webinar, and for giving up her time. To Gina and to Sharon, you know, really thank you as well for giving your insights and for really adding so much value to the presentation and to the webinar, which, you know, going through a policy which is so dense, you need to kind of to hear people's perspectives as well. So yeah, and thank you to Kate and to Danae as well, behind the scenes who've done so much. Yes, so thank you. I will leave it at that, and I wish you all a very safe and kind of a rest of the week. So Vermila Michael, thank you all.